Hi, I'm here at X4, the Experience Management Summit that's put on by Qualtrics, a company that helps other organizations measure, manage, and improve the overall customer experience. It's attended by organizations like automakers, retailers, banks. But what's been a pleasant surprise is actually the number of healthcare organizations that are here at the conference and the number of healthcare sessions that are put on by the event itself. I had the chance to actually catch up with one of the presenters, Dr. Jason Guardino, the Chief Experience Officer at the Permanente Medical Group. I wanted to ask him a tough question. How can we in healthcare expect already overburdened physicians, nurses, technicians, and staff to improve the patient experience when they're already overworked? Here's what he had to say. Dr. Guardino, welcome to the program.
Thanks, I appreciate you having me.
So we were just on a panel together and we were talking about patient experience, staff experience, and the whole sort of customer experience we have in healthcare. And one of the questions I want to dive deeper with you is, we know in healthcare, we're at max capacity. You can't really expect more of clinicians, physicians, nurses, anybody. So how do we help move the needle forward in terms of patient experience without adding more already to a saturated staff?
It's a great question. And what I would say is, when you look at research and the science behind providing great experiences, it can benefit our people, physicians and nurses and so forth. It can provide higher quality care. That's all in the literature, right? Better blood pressure control, better blood sugar control, lower lengths of stay in the hospitals and so forth. But the question to your point is like, well, I'm already tired, I'm already burned out, we're short staff, what's in it for me? And what I would say is, first of all, we have to debunk a myth. Creating a great experience doesn't take very long. In fact, research again shows, there's an old study out of Philadelphia, I think, that it takes about 30 seconds for a physician to lean in, provide compassion, and then create a more warm, meaningful experience. So we're talking 30 seconds that get a benefit of a great experience to that patient, and in turn, it bounces back to me as the physician. So it doesn't take a lot of time. So we need to get rid of that myth. And then the other thing too is when I focus on the experience as a physician, the research shows that I'm less likely to make a major medical error. And I think there's nobody in medicine, whether it be a physician or nurse, that doesn't want to make less errors, right? And so I think, leaning in, it doesn't take long. It can be a few extra seconds of a conversation, right? There's all kinds of studies out there where, physicians interrupt you 15 seconds after you begin talking and so forth, right? It just doesn't take long. The perception of time is magnified when we're under stress, but if you watch the clock, 20 to 30 seconds is what it takes to create a passionate, caring moment.
So how are you implementing this and rolling this out at Kaiser Permanente?
Yeah. Well, first of all, we're trying to get all of our people back to their why. So if I always say, anybody who went into healthcare, whether that be a medical assistant, a nurse, a physician, or what have you, somewhere on a paper, on an application, they wrote, I want to go in this to help people. And then they go through the training, and then they have bad bosses and leaders, and then they become more and more jagged, right? We need to bring the people back to that. And that's what we're trying to instill in our people at Kaiser Permanente in Northern California is our common purpose. And our common purpose is about creating caring moments. It doesn't take long. We want everybody to understand also that it's not just the people in front of the patient providing care. Everybody in my mind is providing care. I cannot take care of a patient in the winter if the hospital is freezing. HVAC people, I come from an HVAC family. My dad was an HVAC guy, so they're providing care. If I don't have the gauze or the tools I need, the finance people, they're providing care, right? We have a lot of data analytics people to follow the quality of the care that we're delivering. They're providing care, right? And so we want everybody to understand and come back to the why. And that's really what we're trying to focus on with some of the trainings that we've developed.
want to touch on something you just said there. You said you're using analytics to analyze these steps. So what kinds of technology, what are you looking at to figure this out?
Well, so we are, to be quite frank, we're masters at analytics in finance and HR and quality. So, for example, in Northern California, we have built robust quality management systems. Mm-hmm. So we know when a woman gets her mammogram, we know when she gets a biopsy, what the biopsies show, when the surgery was, when the next mammogram is due. We are managing that quality, right? So we do a lot of those analytics, and we have a whole team and a department of analytics that help us have revolutionized our quality in the last 20 years to become one of the nation's leaders in providing highest quality of care. What we need to do is now use robust analytics to manage the experience in the same way. And so that's why, we're partnering with Qualtrics on the Permanente Medical Group, is so we can manage the experience like we do with the quality. So we're not there yet. We're not there yet is the point, right? So we're really there with quality and all these other things, but getting the management piece of the experience is really what we're focused on now.
So it sounds like you're just applying almost the same rigor that you do to the quality side and the finance side now over to the experience side.
Exactly right. So in 2003, 2004, we basically put a stake in the ground and we said, we're going to be known as the best, highest quality healthcare leader in the industry. And back then, our colon cancer screening rates maybe were in the 40 percentile. So 40% of our people were screened for colon cancer. Fast forward to today, 84% of our people are screened for colon cancer. And we made a conscious effort to focus on delivering high quality care over the last 20 years. Now we got to do that with experience. The exact same thing, to your point.
Let's get practical for a second. I want to give our audience something practical they can take away from our time together. If I'm not at an organization as well funded, as large as Kaiser Permanente, what advice do you have for someone who be listening and watching? Like, what can they do to kind of start this journey, or maybe get some buy-in from their executives for even just putting more resources and time to these kinds of experience efforts?
Well, I always say that you could look at experience efforts with two lenses. There's the business lens and there's the clinical lens, right? That clinical lens is what we talked about: higher quality care, less likely to make major medical errors and so forth. That speaks to the healthcare providers. So what's the business side? Well, the business side says basically, if you focus on experience and you have great brand loyalty, that's going to drive your business more than cost can, right? People are actually willing to pay a little bit more for great experiences. And people are actually more likely to forgive you if you're known to create great experiences, right? And then the other thing too, the one that speaks to the business side, is cost. Great experiences drive down the cost. If you focus on having great experiences, it's actually costs you less to provide the healthcare and so forth. So I can give you examples, but it absolutely is imperative.
So you got to bring both to the table.
That's right.
Talk on the clinical side, bring in the financial side, and hopefully you convince your executives to give you some airtime for this.
Right.
Well, Dr. Guardino, thank you so much for being on our program. Really appreciate the information you shared with us today.
Yeah, no, it's a pleasure. I super appreciate you having me, Colin.
I want to thank Dr. Jason Guardino for coming online with me and being willing to answer some pretty tough questions about healthcare and the patient experience. I thought his answers were pretty insightful. And hey, if you enjoyed this interview as much as I enjoyed being part of it, we'd love for you to subscribe, rate, and give us a review on iTunes, YouTube, or wherever you're listening and watching this. Plus, head on over to Swaay.Health for the latest and greatest information and news and articles from the world of healthcare marketing. I'm Colin Hunt. Thanks for being here.